Hi class, my name is Tony Howry and I am going to be your instructor for the next 8 weeks as we begin this course. I wanted to just go over a few items with you as we begin this journey. For some of you, this may be your first online course. For others of you, you're pros, and so I apologize if this ever feels redundant, some of the information I'm going over, but I just want to be clear on some expectations. Um, so, like I said, my name is Professor Tony Howrigi. I'm a licensed marriage and family therapist. I am an adjunct professor both for the undergrad and graduate programs, and also I have a private practice and I supervise future clinicians. So that's a little bit about me and my background. I think this class is great whether you are looking to do lifespan development in regards to becoming a teacher or working with children, or even if you plan on being a clinician. I know this is a course that you need to take, so I don't necessarily know why you may be taking this course, but I do find it very interesting, and maybe even more so now as a parent, I can see how interesting this type of class is because I am living with some of the lifespan development ages. Not to mention, as we age and get older, we get to see how lives change and some of the deterioration process and things that go with aging over the lifespan. So we'll cover a wide gamut of things. Now, with this class, because it's fully online and we do not have a hybrid model, um, what I have every week is I'll have a live lecture. Now, I'm not trying to bore you by basically going over a PowerPoint and basically just like questioning your intelligence by reading to you what you can read. However, some of what I may be doing is going over the PowerPoints with you. Now, some of this would happen in class as well. So I don't want you to think I'm questioning your intelligence or your ability to read, but this is kind of an outline of the chapters. Now, with a fully online class, I'm really depending on you to read your textbook. It's going to be important. It's going to be necessary for the tests. And just further information for yourself. I believe the text is pretty clear to understand, but I just want to reiterate, you are really expected independently to read your readings that you're expected to read over the course of the next 8 weeks. It is a lot of information. I do fully understand that this is not your only course, and there may be a few weeks or a week or so within the semester I might grant grace and maybe relieve you of a discussion board because I know there's a lot going on in 8 weeks. I know I'm probably not your only course, and I know that you're trying to keep up with everybody else too. And 8 weeks is a very fast pace because you have papers and tests and a capstone project, and you're trying to digest all this material, and it can be very overwhelming. So please know that I'm not sympathetic to what you're going through. I also know we have to get through our material as well. So if you have never done an online course before, you are required, Monday is day 1 and day 7 is Sunday night by 11:59. Okay. So I myself do not accept late work. That is part of my policy. I don't like seeing how students try to figure out how late they can be in order before how many points they lose. If you're taking that much time, in my opinion, to figure out how late you can turn an assignment, then there's a problem with that. That's just not how I roll. Now, if there is a life altering event that takes place or an emergency or something happens, please email me and I will work with you. I'm not a mean person. However, my expectation is that everyone turns in their work on time. Now, within that, for the capstone project, we're doing this thing where you have to turn things in through Taskmaster. And so I know in the past there's been some issues with that. It's pretty self-explanatory within that week, week 7. It discusses, I believe, how to go about doing that within your learning activities. But I just want to be clear. The expectation is that's how you turn in your final because I have to grade it within a certain rubric in order to meet expectations for the online and professional studies program. So anyhow, if you ever have any questions, please don't hesitate to email me or call me. Both my email and my cell phone number are located in the syllabus. And again, I'm not here to try to make your life more difficult. I want to help you as best as I can, and I do try to respond to my students as quickly as possible. I don't like things to be um, unclear. With my grading, I tend to grade within the week that things are submitted. I try to stay on top of it as best as I can. I'm not going to say I'm perfect at it, but I try. Like if a paper is due that Sunday, by the following Sunday, I try to have everything graded. Same with discussion board. So the day it's graded, I give me about a week, and I'll try to make sure um, that everything's graded. Now with discussion boards, you are required to respond to 2 other people. Now, I know sometimes that can feel tedious, or it's like, what do I have to say to somebody else? But please be mindful in your responses, not to be insulting or degrading, or remember you're talking to another classmate and you never know when you may run into somebody else again. Also, I need you to be thoughtful in your responses. I notice as weeks go on, sometimes the responses get shorter and shorter. There is a requirement with how long they're supposed to be, but please just be mindful. I want you to have a thoughtful response to whatever the discussion topic may be. Um, so again, if you have questions about that, please let me know. I will have I might be ahead of the game a little bit. So for some reason, if I record some of these lectures ahead of time and things come up in the in-between time, like common questions, or maybe maybe I give you guys a week off of discussion boards or something. Please be mindful of your announcements, and be engaged in Blackboard, because that's how I'll post things, and that's how I'll get a hold of you, is through your CBU email. So please pay attention to that, because if you don't check your CBU email, you might miss something from me. Or if you never check Blackboard, you might miss something from me as well, and I would hate for you to miss anything, because it's so important. So as for this class, we have a few projects. We have Bringing Up the Perfect Baby, Video Games, the Greatest Threat to Adolescent Development, Being Empty Nesters in Middle Adulthood. We have a few essays, How to Incorporate Christ in a Child's Personality and Social World, talking about kid adulthood, at what age do we become adults, and you have your capstone project, which you'll create a seminar. So based on this, our discussion boards are in total 150 points. The projects are total 300 points. They're 100 points apiece. You have 4 exams, and they're 50 points apiece. And then you have 2 essays, which are 100 points apiece, and then your capstone, which makes it for a total of 1,000 points. So again, like I said, I will grade as quickly as I possibly can to make sure I cover everything. I will leave as many comments as possible. Sometimes I'm not super in-depth. I might just give you a broad overall comment, but just be mindful that these are the point breakdown, and this is again in your syllabus. Every week it says week 1, day 7. Now, if you look to, I believe, I'm looking at the syllabus myself, I printed it out. Week 7, okay, so week 8, the capstone is due on day 2, okay? So the reason it's due on day 2 is because I have to grade them all pretty much right after the class is finished. So that gives me more time to grade. And your exam is due on day 5. So if Monday's day 1, so Monday, Tuesday, Wednesday, Thursday, Friday is day 5, okay? So please remember that. Again, your capstone is due week 8, day 2, and your exam is due week 8, day 5. So now, just remember professionalism. All work is meant to be APA format. If you have questions about that, you should hopefully own the APA manual. And again, with just how we talk to each other, remember these are your classmates, potentially future colleagues. Please have good discretion. I will try, of course, to convey things from a biblical context and an integrative kind of model. And if you ever have any questions or concerns, please don't hesitate to email me or to call me, or just to let me know what you may need from me or how I can help you. Now, because this is 8 weeks, we go through a lot of chapters in a week. So I could go slide by slide for 3 chapters, and you'd be on here forever listening to me. So I'm just gonna, because I've already taken 10 minutes of your time, just kind of going over some basic information. I'm gonna go ahead and just go over chapter 3. Now the first few chapters talk about lifespan as far as theoretical orientation, so Adler and Erickson and their different stages of development, which there's a lot of different theories and based on different stages. So that's what's in those first few chapters. This chapter starts going over, prenatal development. So that's what I'm kind of going to talk about today. And so I really do expect you to look over your textbook. It's really important. But you have the basic concepts and methods, theories of development, and then prenatal development. So anyways, that's kind of the plan. So hopefully, again, I can give you a brief synopsis. I try to bring real life into it as much as possible and not just bore you with just reading the text. But like there's tons of slides on here. There's 62 slides. I'm not going to get through 62 slides. But hopefully I can overcome a lot of information. So, okay, so going off of this. So again, obviously we know basic science, there's chromosomes that help develop gender. You have X and Y chromosomes. We have the potential for multiple birth. We have potential for twins, identical, fraternal. We have a chance, obviously, for a single birth, which is most births. And again, we are all given a genetic blueprint. This is something like, again, when you look at pregnancy, and some of you in this course may have been pregnant before or have children, there's so much writing on such a moment by moment basis, especially at the very beginning of development. It's very astounding, almost like breathtaking when you think about one little thing could go wrong and the whole process doesn't work. It really does show God's intricate design and care when you look at the development of a child, and even what goes into labor and delivery and how a woman's body changes and all those kinds of things in preparation for children. There is so much intricate design that goes into this process. So there's been a lot of different research studies done on twins. And okay, so again, going into genetics, right? Like how we break down like blue eyes. Like, for example, I have hazel eyes, my husband has brown eyes, and my mom always says that we're going to have this blue-eyed child. And I'm like, I don't know if it's possible, Mom. Like, yes, I didn't realize that we have blue eyes on my side of the family, but my husband is Hispanic, and I'm pretty certain there is no blue eyes on his side of the family. So I don't know if it's possible. So this is a breakdown of curly hair and how that would potentially pop up for a person. You'll hear people talk about those kinds of things, and sometimes what we want may not be within our gene pool, right? And that's okay. So this kind of is a little table of talking about how that works with our genes. Let's see here. So this talks about different types of genes and disorders, right? 2 copies of an abnormal gene must be present for the disease or trait to develop. And we know there's a lot of different kinds of disorders that are as a result of genes, right? These are some of the syndromes: extra fingers, migraine headaches, schizophrenia, high blood pressure, sickle cell disease. So anyways, these are some of the diseases that come with our genes that we have no control over other than the fact that this is how we were designed. This is our blueprint. This is our map. So again, inherited characteristics based on our sex links, so based on being an X or a Y chromosome. And then again, sex-linked disorders caused by recessive genes on X chromosome, so color blindness, hemophilia, and Fragile X syndrome. Again, these are some of the things that we may not all think about very often, but do come up as a result of just, again, our blueprint that is so intricately designed when 2 people come together. Some of these things you would not know of. Now, some people know they have genetic potential disorders that they bring to the table, and couples may consult about certain decisions that they may make as a result of that. I knew someone once who, her father had a genetic, I think it was like some sort of autoimmune problem that would be passed on. And so him and his wife decided that they would not use his genes in order to create children, and so they use somebody else's in order to in order for them to be able to have children. And they picked the same sperm donor for both children. However, he obviously raised them. They were his children, but he just didn't want them to have the probability of getting some of his genetic issues, which some people make those kinds of decisions. Other people go through great lengths to figure out their DNA problems and try to decide what kind of decisions they need to make in regards to having children. Science is pretty in depth nowadays versus in how it used to be in the past. They ask a wide variety of questions when a woman gets pregnant, as far as history and things of that nature, and even with ethnicities carry certain potential issues, and again, what decisions then could be a problem. They offer screenings early on for people to make certain decisions or to be prepared for maybe particular problems. So there's a lot that happens in those first, in that very fragile time of development for a fetus, and for some people even before they even decide to have kids. So it's just a lot of things that already start within a life before life is even, I mean, from the moment of conception, a lot is going on within a woman's body. So again, these are talking about more errors within chromosomes. There's 3 chromosomes rather than the usual pair, 1 chromosome rather than the pair. So again, all these kinds of abnormalities that could happen. So the zygote implants, this is the first trimester, right, in the uterus. The cervix thickens and secretes mucus to protect the embryo, and the uterus shifts and puts pressure on the bladder. And then, of course, you have the missed period, which is usually a sign of pregnancy. Prenatal care is huge. And some of the problems that occur in this stage are ectopic pregnancies, and that's when a pregnancy develops potentially in the fallopian tube. You can have bleeding and miscarriage that can occur. Other things that in the second trimester that could happen is weight gain. Fetal movement is felt, and usually an increased appetite. Doctor visits, I mean, they talk about, usually you're coming into the doctors usually about once a month. And then it ups as you get into the third trimester. They're looking for things like gestational diabetes, which has to do with how your body's processing sugar, blood capabilities with Rh negative, Rh positive, blood pressure, and again, you still have the potential even in the second trimester of miscarriage or premature labor, right? And that's the thing when it comes to pregnancy, and we look at it from a spiritual component, is, from the moment of conception, we really are gods, and we really don't know. We really have to just trust that it's in his hands, because you never really know what could happen. And there's plenty of women that have experienced, miscarriages or stillbirths or things that are of course horrible, but maybe showed no signs of happening. Or you have women that had plenty of babies and never had any issues. You just really don't know, and sometimes you don't always have answers for some of these problems. But like, we feel a lot of times women feel better once they've reached the first trimester, but that's not to say there couldn't still be problems in the second or third trimester. Not that we hope for those things. And then the third trimester, women's breasts start getting prepared for nursing, and there usually tends to be bonding that goes between the mother and the baby. A lot of times too, even for fathers, there's some bonding that starts to occur once baby's movement can be felt. It's a totally different experience for a man, right? Because he's not the one carrying the child, the woman is. And so I think it's a little different for him than it would be for her. You can start feeling hiccups and kicking, and the baby moving way more later on in the pregnancy, and especially by the later weeks in the 30 weeks of pregnancy, you're maybe actually seeing the baby move, or an elbow, or you've seen those really cryptic pictures where it's like you see like a foot coming out of someone's stomach. I mean, it's amazing, but also trippy at the same time. It's kind of bizarre until you've experienced it yourself. So again, some issues that can occur is, it's really dangerous to have high blood pressure, bleeding, bladder infections, premature labor. A woman is considered at term at 37 weeks. So if a woman delivers at 37 weeks, the baby is not considered premature. However, You know, we get a due date of 40 weeks, and some places will let you go up to 42 weeks of being pregnant, which is a long time of being pregnant, right? Every woman's pregnancies is different in how comfort or not comfortable they are. So some women are very eager to get to a time when they can have a child, and other women, you know, they feel great. So there's the implantation. So there's specializations of cells that need to support the development. And so from week 2 to 8 weeks after conception, there's the neural tube that develops, and that's why they say that folic acid and things of that nature are so important, because it helps with the formation and having a healthy baby. Many organs and things like that start to work and start to function. And weeks 8 until birth, they grow from about 1/4 of an ounce and 1 inch to 7 pounds and 20 inches in length. So we got all the organ systems. Viable at week 24, full term at week 37. That's what I mentioned. Which, you know, even from weeks 24 to 37, that's a lot of time of development and things. So, I mean, it is very critical if the woman does have a baby that premature at 24 weeks. You know, I mean, it's viable, but again, there could be a lot of problems like with lung development and things of that nature. It can be very stressful. So again, a neuron, which is part of a cell. So you got the cell body right here, dendrites, and then the axons. So they increase in size even after birth. And this is just an example of fetal development. See a baby yawning. And it's amazing to see, like, these, I mean, these ultrasounds nowadays are crazy, you know, all that you can see. And then this is an example of a brain inside a person, right? The baby's brain. And how everything is beginning to grow and be structured. So prenatal sex differences: males tend to be more physically active, they have higher rates of miscarriage and more vulnerable to prenatal problems. Females are more sensitive to external stimulation and more rapid skeletal development. So males more physically active, vulnerable to prenatal problems. Like I said, sex differences: prenatal hormones linked to cross-gender variations and prenatal problems. So maybe sometimes, you know, people can say, oh, I think I know I'm having a girl, or oh, I think I know I have a boy. And someone once told me I have 3 sons. Someone once told me, do you know what you need to, do you know what your likeliness of having another gender is? And I was just all ears, and I'm like, no, what's the likeliness? And they said 50-50. And I was like, oh my gosh, you just totally annoyed me right now, right? But you know, people can think all these things, and you really just don't know until you find out. Sometimes they say you can sense it through a heartbeat, if the baby's heartbeat's high, or if the baby's heart rate's low, and all kinds of things like that. You really don't know until someone like actually tells you. So, so fetuses can differentiate between familiar and novel stimuli by 32 and 33 weeks. Newborns can remember prenatal stimuli and react accordingly. Very active fetuses tend to be active children who can be labeled hyperactive later on. And I will say this, like, depending certain sounds or music that you listen to, some of those things could be soothing to a child even after they are developed. This is a fetus, right? And so you're seeing how it develops and grows. This is the earlier stages here, right? The early fetal stages. And so obviously drugs, alcohol, certain kinds of issues can create problems in pregnancy, and so you have to be very conscious and conscientious when being pregnant, right? We have all these things we shouldn't be taking or doing or exposing ourselves to if we're going to be pregnant or are pregnant. And it's important to be mindful of those things because they can affect and damage a fetus. You know, you think back into the days of the 1950s or 60s, and people smoked like it was going out of style when pregnant. Now that would be like a CPS report, probably, basically, if something of that nature was seen, because we look at cigarettes so differently now. But there are a lot of things that they try to keep women from, away from, like lunch meat, and because we're concerned about listeria, and we're concerned about certain antibiotics, and we're concerned about obviously no alcohol or drugs or things of that nature, smoking. Um, so anyhow, there's just a lot to be conscientious of because it's such a sensitive balance that's happening in a womb. And we want to protect it as best as we can, especially with things that we can control, like the environments that we put ourselves in and what we put into our bodies. So I hope this information has been helpful and gives you a little further insight. And again, please look over chapter 1 and chapter 2. And this is just highlights basically of chapter 3. But I look forward to hopefully guiding you through the lifespan development and hoping you to better understand development. And we will get to know each other a little bit better over the course of the next 8 weeks. Have a great day, and I look forward to seeing you next week.